Can you get pregnant with one fallopian tube? Are you able to get pregnant even if you have one fallopian tube? Funa olubuto wadde nga obadde olina oluseke olumu, kyandibanga osobola okufuna olubuto wadde newankubadde obadde olina oluseke olumu. In this video today, we are going to answer a question asked by one of our viewers who said, can a woman get pregnant even if this woman has one fallopian tube? Gerald Massa, the health educator, is the name of the channel, and on this channel we do create awareness about fertility, reproductive health and ultrasound scans. So if you have any questions in regards to fertility, reproductive health and ultrasound scan, then this channel is for you. If you are a couple and you are looking at getting pregnant, you have tried several remedies, you have taken all the drugs and you are still not getting pregnant. Your doctors are telling you you have an issue with unexplained infertility, then this channel is for you. You are going to learn lots of things from our channel. Obanga badde oli mukyala muli couple mugezako kubanga mufuna olubuto naye nga ate bikyaganye, then ku channel eno tukwaniriza tugenda kuba tu answeringa oba tugenda kuba tuddamu ebibuzo bino byonna. Amanya gange buuza omusawo Gerald Massa. So we have said that can you get pregnant even if you have one fallopian tube? The first key thing we need to take from this video is that the fallopian tubes are those tubes which actually transport a fertilized egg to the womb where it is implanted, and where it is implanted or it attaches and then grows into an embryo or it grows into a baby. The fallopian tubes oba enseke ez'omukyala ze tuyita fallopian tubes zezo ezitambuza eggi eribadde fertilized ne liba nga liyitamu, ate we liba lituuse ku kisenge kya nabaana ne liba nga lisobola okubanga lyekwatako okumakinga sure nti likula ne lifuuka omwana. So what if we have a scenario whereby the fallopian tube is actually okay, and then all of a sudden you go through maybe a surgery, maybe after having had an ectopic pregnancy, and then your fallopian tube gets worked on, it gets operated, and then probably in the process you lose your fallopian tube and you remain with one fallopian tube. Are you able to get pregnant? Obanga obadde wali ofunye ku operation, bali bakukoze ku operation ey'oluseke bagiyita salpingectomy. So obanga bali bakoze ku operation eyo ne babanga oluseke balugyamu ate ng'olina oluseke olumu olwasigalamu, ekibuuzo kiri nti osobola okufuna olubuto wadde ng'obadde olina oluseke olumu? So without further ado, we've discovered that the fallopian tube is that part, or it is that circular lengthy tube which is kind of like a straw which actually transports an egg onto the womb where it attaches and then it implants and then it grows into an embryo or a baby. So if you have one tube, then the most important thing we need to understand is that on the fallopian tube there's a structure which is known as the ovary. So the ovary is where the egg grows from, where your eggs are going to grow from, and then on the 14th day the eggs are going to actually be mature and then ready, and then they will actually be released through a process known as ovulation. Oluseke lulina part gye tuyita ovary. Part eyo yebeeramu amagi agakula ne gabanga gatuuka ku lunaku olw'14. We gatuuka ku lunaku olw'14 tuba tugayita mature Graafian follicle, era amagi gano ebiseera ebisinga oba eggi lino erifuuse mature oba erikuze tuliyita the dominant follicle. A dominant follicle has a diameter of at least 17 to 25 millimeters. But on average, most women have dominant follicles of at least 20 millimeters. So if you are able to ovulate on the 14th day, if you are able to go through the phases of the menstrual cycle, that is the proliferative phase or the estrogenic phase, and then if you are able to also ovulate on the 14th day and then even go into the luteal phase, when your hormones are balancing, then it is very possible, it is very possible for you that you can get pregnant. So in this video today, one of our viewers asked the question, can you get pregnant with one fallopian tube? And the answer is yes, you can get pregnant even if you have one fallopian tube, but this fallopian tube has to be patent, it has to be open, and then the ovary should be able to undergo the process of ovulation. Tugambye nti osobola okufuna olubuto newankubadde obadde olina oluseko olumu, naye ate oluseko olwo lulina okuba nga teruli blocked, lulina okuba nga luli open, ate n'ekirala amajigo galina okuba nga ga undergoing a process gye tuyita ovulation. So you can get pregnant even if you have one fallopian tube, but your tube should be open, and then the ovaries should be functional, and then your husband should be having sperms of good quality and good quantity. If you would like to have a private session with me, a private consultation with me, many of my clients are actually booking. I'm sending out my greetings to all you, my clients, who have been able to do the booking. And yes, I've given you lots of, we've allocated time for you, and we've answered all your questions. I'm sending out my greetings to all of you, putting in prayers by God's grace that things work out for you and you also do get pregnant and get to give a testimony. So you can book to have a consultation with me through my numbers +256 701 79 78 and 76. That's +256 701 79 78 76. You can do the booking through that number, and then we shall talk on WhatsApp. We can actually even talk on Zoom if you are okay with it. Consultation fee when you are in Uganda, it's only 15,000 Uganda shillings, and then if you are outside Uganda, then it is $10 US dollars. So outside Uganda it is $10 US dollars, and then when you are in Uganda it is only 15,000. So you can always deposit the money through that same number I've given you, which is actually even below this video, and then it's registered in my names, Gerald Massa, the health educator. After doing the booking, please connect with me on my WhatsApp, and then we shall have a more one-on-one consultation where I'll give you my best recommendations, my best advice on how you can get pregnant faster naturally. If you are a couple and you have tried to get pregnant, then talk to me on my WhatsApp, book, so that we give you time and then talk to you and answer all your questions. Wobadde oyagala okubanga oyogeramuko nange, ogezezaako okubanga ofuna olubuto, mulimu percentage y'abakyala abajja okufuna olubuto nga tebafunye wadde assistance, nga tebafunye nakuba nti oba boogera n'abasawo, teboogera naffe, naye ate mulimu percentage y'abakyala abajja okubanga bajja kwetaaga okubanga boogeramuko n'abakugu. So wobadde oyagala okwogeramuko nange one on one ku WhatsApp yange, osobola okubookinga kuba abalwadde bonna bendi okukolako ku WhatsApp bali kusasula, bali kubookinga. Oba oli mu Uganda, mutwalo gumu ekitundu gooka okuteeka ku Airtel number eno yennyini eri wansi wano, eri 0701 79 78 76. That is 0701 79 78 76. Eri mu manya gange gennyini Gerald Massa. Oba after ngomaze okubookinga tujja kuba tusobola okubanga twogera nkuwe advice ku ngeri ki gy'osobola okubanga ofuna olubuto amangu. And then also we can also talk more after you have done your booking. Thank you for watching today's video lesson. I hope you've learned something. I hope you've learned that when you have one fallopian tube, you can still get pregnant, but the ovary should be functional, the fallopian tube should be open, and then also your husband should be having sperms of good quality and good quantity. See you in my next video tomorrow, and have yourself a fantastic and healthy day. God bless us all. Bye-bye. What is Mullerian agenesis? What is vaginal agenesis? In this video today, we are going to answer the question, what is Mullerian agenesis? What is vaginal and uterine agenesis? Did you know that you could be a woman, but when you lack the reproductive system, when you lack the vagina, you do not have the vagina, you do not have the female reproductive system, and you are asking yourself, what is this condition called? In this video today, we are going to talk about vaginal agenesis, uterine agenesis, Mullerian duct agenesis, and also the Mayer-Rokitansky-Kuster-Husser syndrome. In this video today, we are talking about all this. Welcome to our channel, Gerald Massa, the Health Educator, and on this channel, we do create awareness about fertility, reproductive health, and ultrasound scanning. So, without further ado, we shall begin by defining what we mean agenesis. Mu video yaffe eya leero tugenda kwogera ku biki ebiyitibwa vaginal agenesis oba uterine agenesis oba Mullerian duct agenesis. Osobola okuba nga oli mukyala naye ate nga obadde ebitundu by'ekyama bye tuyita vagina nga tobirina. Mu video eno leero tugenda kwogera ku condition eno, kiki ekireeta embeera eno okuba nga ebeerawo. So we were saying that agenesis simply means the failure of an organ to form. When an organ is supposed to be forming, let's say during pregnancy, and then maybe that particular organ does not form, then we call that agenesis. We are talking about Mullerian agenesis. We shall go step by step. Do not worry, we shall define everything and we shall explain everything together. So we've said that agenesis is the failure of an organ to form. Agenesis kitegeeza nti ekintu ekyandibadde kiforminga tekiforminga. Katugeze obanga obadde oli lubuto naye ate nebanga waliwo part ebadde erina okuba nga eforminga naye ate nebanga teforminze, mu luzungu tukiyita agenesis. Mullerian agenesis means that the Mullerian ducts are those early embryonic structures, or they are the parts where the sexual organs are going to be forming. For example, the uterus or the womb of the baby, and then the vagina where it begins from. We call it the primordial embryonic structures, where that part or where the sexual organs are going to begin from forming. It's what we call the Mullerian ducts. Ideally, if at all the sexual organs are supposed to be forming and then they do not form, then we call that the Mullerian agenesis, Mullerian duct agenesis. So in this video, we are talking about vaginal agenesis, Mullerian agenesis, and uterine agenesis. Tugambye nti mu birwadde bwe tuyita Mullerian agenesis, parts ez'omukyala ezandibadde ziforminga ziba teziforminga. Ogenda okulaba nga omwana azaalibwa ng'ate ebitundu by'ekyama aba tabirina, then kiba kitegeeza nti yandibanga alina kino ekirwadde kye tuba tuyita vaginal or uterine agenesis. Remember, you can ask me all your questions in regards to fertility, reproductive health, and ultrasound. I will answer all your questions down below this video, and you can also do your booking if you would like to talk with me, to consult me in privacy. Then you can book to talk with me on my WhatsApp numbers. The number is just below this video. So we've said that vaginal agenesis is the failure of the reproductive organs, more specifically the uterus, from forming. Then this is normally associated to genetical makeups or genetical compositions during pregnancy. If at all a woman who is supposed to carry a particular number of chromosomes does not carry those chromosomes, or there are chromosomal abnormalities or genetic abnormalities, then there are high chances that you can end up with a condition known as vaginal agenesis or uterine agenesis. In simple terms, the uterus or the vagina may fail to form. How can you confirm that you could be or you could have a child who is having vaginal agenesis? In most cases, this condition is also known as the Meyer-Rokitansky-Kuster-Hauser syndrome, MRKH. Now, this condition does not show. Actually, you may not be able to detect this until when a woman or when a girl is supposed to begin her menses and then she does not see her menses. Then that's when we may begin to suspect that there could be a problem. The other thing is that she could be going through her menstruation, she could be menstruating, but because the vagina did not form and the uterus formed inside, then blood is going to collect inside the womb. And when blood collects, imagine a situation where a woman is supposed to be menstruating every month, and then because there's no opening for the blood to flow out, it collects inside, and the lady or the woman or the girl may begin telling or complaining of a mass which is around the pelvic organ or a swelling around the womb. So tugambye nti obanga obadde oli muwala ate ng'olina kino ekirwadde kye tuyita Meyer-Rokitansky-Kuster-Hauser syndrome oba mu luzungu kye tuyita Mullerian agenesis, ojja kulaba nti wandibanga otandika okufuna kye tuyita amenorrhea. Amenorrhea kiba kitegeeza nti obadde olina okubanga olaba periods zo naye ate n'obanga tosobodde kuziraba. Amenorrhea is absence of the menstrual periods or absence of your periods. So sayini esooka gye tusobola okulabirako ne tugamba nti wandibanga olina ekirwadde kye tuyita vaginal or Mullerian agenesis, periods oba toziraba. Omuwala aba agenda mu nsonga ze, jjukira n'abaana ayinza okubanga yafoominga naye ate ebitundu by'ekyama tebinafoominga bye tuyita vagina. So omusaayi guno gukolektinga ne guleetera ekitundu kino ekyannabaana kye tuyita pelvic region okubanga kizimba. So we've said that the first classic sign of confirming that you could be having the Mullerian agenesis or the Meyer-Rokitansky-Kuster-Hauser syndrome is that there's going to be amenorrhea. There's going to be a feeling of fullness or there's going to be a mass around the pelvic region, and we have said that this mass is due to collection of menstrual blood which has nowhere to go, because remember, the vagina did not form. We are talking about Mullerian agenesis. Remember, if you have any questions, you can consult me on my WhatsApp. You can also do the booking so that you talk to me about all your fertility questions. I will give you my best recommendations. How can you confirm that a child has Mullerian agenesis? How can you diagnose Mullerian agenesis? How can you confirm that a child has the Meyer-Rokitansky-Kuster-Hauser syndrome, MRKH? The only way or the best way to confirm Mullerian agenesis or to confirm that a child could not be having her private parts, there could be actually absence of the womb. It could be that the vagina has not yet formed. You have a child and the child is a girl. She's complaining of a mass. She's complaining of a swelling around her pelvic region, and she's also not seeing her periods. Then the best way to do is talk to your doctor, take the child to your doctor, and then your doctor will request actually investigations to be done. And the best way to confirm that a child could be having Mullerian agenesis or any of these abnormalities of the reproductive system is by doing what we call a pelvic ultrasound scan. A pelvic ultrasound scan will give clear images of how the uterus has formed, if it has formed, and then if at all the uterus or the womb is not there, then on ultrasound scanning, nothing will be seen. There will be absence of the womb, or where the private parts or the vagina is supposed to be, it may actually show that there's no vagina. So the only way or the best way to confirm that you could be having or a child could be having Mullerian agenesis is by doing a pelvic ultrasound scanning. If the ultrasound scanning does not show, but still the clinical picture shows that the child could be having Mullerian agenesis, then the best way, actually the most important way compared to ultrasound scanning, the first test which will be requested by your doctor is what we call the magnetic resonance imaging, or the MRI. The magnetic resonance imaging, or the MRI, is much more clear because it will even give a more detailed picture or a more detailed report of what is happening to the Mullerian ducts or what is happening to the whole reproductive system. So if you do not have the MRI facilities in your country or where you stay, then you may go for the pelvic ultrasound scanning. But if at all the 3D or the 3-dimensional ultrasound scanning is available, then you could opt for that because it will reconstruct or it will show reconstructed images of the whole womb. Tugambye nti osobola otya okumanya nti omwana yandibanga alina ekirwadde kye tuyita Mullerian agenesis? Tugambye nti the only way oba engeri y'okukonfaminga tuba tugamba nti oba olina okumutwala ewa dokita wo naaba nga akola scan eno tuba tugiyita pelvic ultrasound scanning, eba esobola okulaga nabanna y'omwana eri etya, ebitundu by'ekyama kwebiri oba tekuli. Then n'ekirala, the ultrasound scanning will show collection of the menstrual blood. Remember, we said that in vaginal agenesis, normally the uterus is there, but the vagina is not there. So menstruation will happen, it will take place, because actually women who have these conditions, they do ovulate very well. They can get pregnant, but with assistance. So omwana alina kino ekirwadde ekya Mullerian agenesis oba uterine agenesis ajja kubanga alina omusaayi mungi, era we tukola scan tujja kuba tusobola okulaba omusaayi guno nga gukolektinze nga mungi nnyo mu bitundu ebyekyama, ate just because guba tegulina we gufulumira. So remember, these Mullerian agenesis abnormalities or these conditions can be corrected in theater, they can be corrected, they can be treated. You need to see your doctor if you suspect that there could be a problem with your child or there could be a problem happening. If you are a woman and you are not seeing your periods, you are having irregular periods, you've tried to get pregnant but things are not working out, you've been told that you have primary infertility, you've taken all the drugs but you are not getting pregnant, then it is high time you consult me, talk to me. We could actually interact, and then probably you may get the best recommendation by interacting with me. So remember, if you would like to book your appointment, you can book through my website. You can also talk to me directly on my WhatsApp. Consultation fee is, if you are in Uganda, it is only 30,000 Uganda shillings, and then if you are outside Uganda, then it is $10 payable to my mobile money number. It is +256 701 7978 76. It is just below here, +256 701 7978 76. When you book to consult with me, you'll be able to get the best recommendations, the best advice on how you can get pregnant faster, and many of our clients are happy with our services. I'm really looking forward to talking with you, and thank you for watching today's video. We've talked about Mullerian agenesis, uterine agenesis, and also vaginal agenesis, and we have said that Mullerian ducts are those parts where the reproductive system forms from. If it is supposed to form, the vagina is supposed to form, the womb is supposed to form, but it does not form, then we call that Mullerian agenesis or uterine agenesis or vaginal agenesis. It has a collective name of the Meyer-Rokitansky-Kuster-Husser syndrome. Ask me all your questions and I will be able to answer all your questions. Thank you for watching today's video lesson about fertility, reproductive health, and ultrasound scanning. See you in tomorrow's video, and remember to subscribe so that you do not miss new videos we release every day about your health, about how you can get pregnant. Gerald Massa, the Health Educator, is the name of the channel, and see you in tomorrow's video. Take care. May God bless us all. Bye-bye. For you to get pregnant faster naturally, your ovaries should be functional. If your ovaries are not functional, if you are not ovulating very well, then getting pregnant may become difficult. And then also your fallopian tubes should be open. If you are trying to get pregnant and your fallopian tubes are blocked, maybe they are blocked with scar tissue and adhesions, then getting pregnant may actually not be so easy. And then lastly, your womb should be free from disease. If your womb or your uterus has issues with fibroids, endometritis, recurrent urine tract infections, then getting pregnant may be difficult. And also, the sperms from your husband should be of good quality and good quantity. If your husband has sperms of poor quality and poor quantity, then getting pregnant may be difficult. Talk to me today about your fertility, about how you can get pregnant faster naturally. You can book to consult with me. My numbers are +256 701 7978 and 76. After booking, the consultation will begin on WhatsApp. Consultation fee is only 30,000 Uganda shillings if you are in Uganda, and if you are outside Uganda, then consultation is only $10. Osobola okubanga omanya bingi nnyo ebikwata ku bulamu bwo, ngeri ki gy'osobola okubanga ofuna olubuto, obanga ogezezzaako okubanga ofuna olubuto naye ate ne bibanga biganye, enseke bakugamba nti zaazibikira, nabaana erimu ebuzibu, osobola okubanga obookinga okwogeramuko nange. Njagala okumanya ngeri ki gy'osobola okubanga ofuna mangu olubuto, njogera nange leero ku WhatsApp. Bookinga okubanga oyogera nange, nja kuba nkuwa advice entuufu ekwatagana ku ngeri ki gy'osobola okubanga ofuna mangu olubuto. Oba baali bakugambye nti enseke zo zaazibikira, oba muna baana mulimu obuzibu, oba ogezezzaako okubanga ofuna olubuto naye nga tonafuna advice entuufu, bookinga oyogeremuko nange ku WhatsApp. Waba oli mu Uganda, esente ziri $3 gyokka osobola okubookinga ne tubanga tuwayamuko. Nja kuba nkunnyonnyola ngeri ki gy'osobola okubanga ofuna mangu olubuto, ate n'ekirala nja kuba nkuwa ne advice ku biki by'olina okubanga okola okumakinga sure nti ofuna mangu olubuto obanga obadde ogezezzaako okufuna olubuto naye banga bikutawaanyizza. Bookinga enamba yange ya WhatsApp eri +256 701 797876. Tujja kuba twogera. Talk to me today about your fertility, about how you can get pregnant faster naturally. You can book to consult with me. My numbers are +256 701 7978 and 76. After booking, the consultation will begin on WhatsApp.